I would like to request Dr. Rohit Shetty to give a talk on immunomodulators in dry eye research to clinics.
Thank you, Dr. Paras. Thanks, Namrata ma'am, and all the organizers for this slot. Uh, my talk today of immunomodulators is not something as strong as what Dr. Sharon or Deep or the Bhaskar or Paras would speak, because those are things which has a very strong impact in more severe dry eye. This is very basic, the ones which we use in our routine clinical practice, both in cataract and refractive. I do have a research grant from these companies, but they don't have a direct impact on what I'm speaking. These are all pure run research, even before the companies adopted and accepted these drugs. When you look at the ocular surface, this is a work done by Sharon as part of her PhD. She's going to defend next Monday, at the same time. So what she did was she looked at the ocular surface cells. It took a long time, more than 4-5 years of understanding every cell components and how each of these cells have a beautiful balance of hemostasis, both the conjunctival cells and also the corneal epithelial cells, and how each of those cells have filled with all the adaptive and innate immunity cells. And this is very important because understanding this has a huge impact in how we treat and how they respond to a treatment. This is a healthy environment of an ocular surface. We use the holotomography to image. This is not the live human cells. These cells are from on a petri dish. Uses a very high definition confocal imaging to study it. And you can see how a dead cell is eaten up by the neighboring cell. The neighbor takes care of its neighbor when it dies, and it gulps it, digests it. These are lysozymes. You create an ocular surface environment which is similar to a dry eye, post-refractive. There is no cells which can take care of the other. Everything dies, and there's a tremendous amount of buildup of inflammatory molecules. And the exact same inflammatory molecules are here, which what Sharon has published. And these cells secrete all of them. It's like your kitchen sink not been cleaned for days together, and it will pump out all unwanted stuff. So how does it impact? It impacts everywhere. Every time you rub your eyes, every time there's a dust getting into your eyes, every time there is an insult, a strong breeze, this waves happens multiple times in your as long as you're living. That means every time something hits, there's a first wave of inflammation, second wave of fibrosis. This is how the body heals, not just with the eye, any part of the body. When you have more of this unwanted excessive of these markers, like what we see here, what happens is the healing completely stops. Then it becomes a completely altered healing. You may end up in pain, irritation, scarring, non-responsive, nociception, and multiple things. So why do you need, in this era where everything in the world has moved from a conventional way of how health is to an unconventional way, where the health is completely altered. Your food we eat is driven by inflammation. Milk is from the cows where you infuse them with steroids, vaccines. Fruits are pesticides. Everything is driven by immune cells. Everything has immune cells in it. You know, me and Sharon keeps discussing that when we have an allergic conjunctivitis patient, you stop them from certain foods, products, the child gets better because it's a dry which is sugar. Sugar itself is one of the most potent immune trigger in the body. And that's why the diabetes is not a sugar induced one. Diabetes is induced by inflammation. And that's what we are here. So when we look at immune modulators, there are immune stimulants and immune suppressants. And immune suppressants can be, there are a lot of drugs today like monoclonal tyrosine kinase inhibitors and all that. But when you look at immune modulators, they are one which prevent apoptosis, cascade system you can reduce, and healing of cells. They're very simple ones. I'm not going into the more specific ones, which I think would need a longer time and a different time to discuss. So when we look at certain things which we started, and this was the same platform maybe 7 or 8 years back when my PhD fellow then Natasha won the Rangachari for bringing in a concept of Trehalose. At that time, it was not a drug. That's how you connect. That's why I like AIOS, because many things what we discussed today becomes reality. And this is a classic example, Namrata ma'am is here, how you bridge a classic animal-based experiments to a drug which has multiple uses. And one of the things what autophagy-driven Trehalose does is it makes the cell to become stronger to swallow the cells which is dead. When it does that, it has a role in creating autophagosomes. Autophagosomes are nothing but a small pouching here, which kind of lyses the unwanted stuff and recycles it. And cyclosporin works on a different mTOR pathway. Again, has the same work of how you kind of work on cell lysing. It's not just like an antibiotic which blocks one part of the bacteria. It doesn't kill anything. It just alters the medium of how it works. So when you look at the same experiment here, and these are all healthy cells. These are all the lysozymes which are all moving around. They're your chemical messengers. They move from one cell to the other, send information. You create a model exactly like a dry eye, complete absence of this. That means there's absolutely no message passed. The cells are just dying. This happens. You will get a new cells, but this happens every time we get the hyperosmotic stress. But when you use with Trehalose or any of these medications, see the same cells regenerate. It's not exactly like what a normal is. You can see the organelles are not fully formed, but it will create it. If you keep this for a little longer time, it will start working. That means the immunomodulators is not going to knock off an immune cell. It's just making the cell to breathe and work better, to function better. So we used different immune cells on this experiment, and what we found was when you create an hyperosmolar status, which is similar to a dry eye state, you create if you create a hyperosmotic status, the inflammation drastically drops down. But when you use with the drug, you don't change the hyperosmolarity, but change the way the cell function to a particular stress. And that is how this whole mechanism of neurogeneration immunomodulators work. But this is a very important slide, and this is what I want you to take home. When you reduce sugar, it's not the insulin resistance which changes, it's the inflammation which changes in diabetes. So we all has been said that you reduce sugar, reduce carb, you suddenly make the cell less glucose, not glucose, it's inflammation. When the inflammation reduces, the cell starts breathing better. So what we did here is something very similar. We took the keratoconus collagen, this is a nuclei of a collagen, lysyl oxidase. You create an inflammation mechanism exactly like what you see in keratoconus. The collagen nucleus is dead. You don't see the same picture here. But minute you bring in Trehalose, the collagen synthesis suddenly appears. And then you bring inflammation with Trehalose, the collagen is still holding on. That just means that any part of the body, you don't need to knock anything off. You just have to reduce or target and make the inflammation more stable. And this is exactly one picture of it. Now, how does it translate to reality? We used, this is the kit which is now for people who want to use it. We tried to look at all the markers, what we said. These were all the known markers which has multiple rows. There are many more panels which will be added to this. And now we have an AI also built-in report. So when you have a targeted way, for example, this is the high level of inflammation without steroid. When you're trying to bring it down, your dendritic cells and T cells in your confocal disappears. When it disappears, what it does is it brings in exactly this picture. It brings in the collagen to resynthesize. It may happen in diabetes, it may happen in lung, it may happen in liver. The same thing happened in COVID. The IL-6, which is the interleukin 6, was the major factor why we got the lung fibrosis and people died during that time, because this is one which causes complete tsunami of COVID, what you saw that, the COVID storm. And when you reduce, people were hitting with steroids. That was not probably the way, because it had other issues. When you modulated it with different drugs, what happens is completely changed the T cell driven thing. This is exactly like what had happened here. The entire dendritic cells disappeared and MMP9 dropped down. When it drops down, what happens is, we have, I think, we and Sharon and Pooja are working on this thing. This is not a single patient, it's cross-linked patients. We have more than now 100 odd patients over 3 years just with this lubricants, and you can see that every single patient has a flattening, which is exactly like what you see with post cross-linking. It just means that cross-linking may be a very end stage of what you probably don't need to do. If you can modulate the state of immune health of the person, you can get the same results. And this is the collagen imaging. This is a collagen with lighter blue means there's no collagen properties. These are all ones we use the cyclosporin, the Sequa 0.9% and trehalose, and you can see the changes happening. The collagen is resynthesizing. This exactly matches to my previous picture here from the animal work, that collagen can resynthesize if you reduce the inflammation. And that's the most powerful thing, and you can reduce the T cells completely off just using a immunomodulator response. Cyclosporin has been used in multiple ways. It works on T cells, calcineurin inhibitors, but it has other role also, apoptosis of cells, and works on how the T cells is. Again, we have worked multiple areas on multiple diseases, nerve regeneration, post-op cataract, nociceptive issues, when patients have more nociception, and multiple areas. There are too many cyclosporin. What we did was we tried to look at a lot of cyclosporins in the market, and what we found was cyclosporins which are very cheaper may make you feel happy, but it gives you this kind of results. We can see some places here, the cells are all dying off. That's why you get irritation, you get pain with certain cyclosporin, because instead of doing what it's supposed to do, it's killing off all the cells. A good cyclosporin should not damage the cells, should actually make it feel better. I'll just take a minute and then I end up. And this is how we are using, when you combine with this is what we can able to achieve. We can see that just without steroid, we can modulate the entire inflammatory molecules of our body. The last one is the resveratrol. It's one of my new areas of interest. It's the wine grapes, the seed, the cover of the grapes, and this has again a huge role in building the collagen. It's reduced the TIMP1 activities with the inhibitors of MMP9, and you can see that it withstands the eye to an oxidative stress. So to sum up here, we have to understand that lubricants, cyclosporin, and all these other things, resveratrols, have a huge area other than just what we have been told it works. It can probably be a biostimulant in ways it's working. And that's why we need to look at this in our post-operative and other areas, and other areas where you want them to, when want the tissue to regenerate. Thank you.